Yes, so a very good morning, one and all, and thank you. My heartfelt gratitude to Dr. GVK sir for having me at this very prestigious platform, and thank you for giving me that very important topic on fermented foods. And I think fermented foods have been a very integral part of our Indian cuisine, and it's not only Indian. I mean to say it's being very it's being very much more prone to liked all over the globe, and moreover it's been valued more because of the food preservation, the flavor enhancement, the texture what it modifies. So with all that, of course, fermentation of foods are very important, and very recently it has gained more attention because of the potential health benefits what it has been portraying. So as per the definition, the fermented foods have been defined as foods that are made through desired microbial growth and enzymatic conversions of food components. So when after something, when we are being talking about weight, something if we have on our plate which is glycemic friendly, which is weight friendly, and which is also gut friendly. So here is the fermented foods is the answer to all this. And when we're talking about fermented foods, it can be classified into two. So foods which have with live microorganisms like your yogurt, kefir or kimchi. I'll be showing you the photographs in my later slides. And foods which have without live microbes, which is your soy sauce or coffee. And let me tell you, these microorganisms may be naturally occurring, or they may be intentionally added as in probiotic. And very important thing that not all fermented foods are probiotic. Probiotic are basically foods where all these strains have been added and they've been proven to have clinical benefits. Of course, we're going to have a wonderful lecture by Dr. GVK sir on probiotics, so I've not added any slides on that. What are the microorganisms where the fermented foods work? So you have we have the lactic acid, we have the lactobacillus, which is mainly important for the fermentation, bifidobacterium, and the yeast, which is responsible. And all these organisms, basically, they drive the biochemical transformations with potential metabolic health. There are different types of fermented foods. So we have the dairy products, where the main sources, which we all know, which is the yogurt and the kefir, and it's the lactic acid bacteria which converts this dairy products into causes the fermentation. Then we have the vegetables like the kimchi, the sauerkraut, which is rich in fiber, vitamins, and which causes and the fermentation derived bioactive compounds. We have the soy and the legumes, the temp and the miso, which is made from soybeans and which are rich in isoflavones. Then the grains, the idli and dosa. So something which I relish here in Chennai is the dosa and the idli. And I was really happy to see the fermented rice over here in the menu. And this is also the kombucha fermented beverage. So based on the predominant end product and the main biochemical pathways involved, the fermentation are categorized into lactic, acetic, alcoholic, and alkaline. This, and it is, I'll just due to lack of time, I'll just see when we're talking about the lactic acid, so it's the sugars which are converted into lactic acid, especially when we are talking about fermentation of the yogurt and kimchi. Likewise, the other the alcohols as well. So here we're talking, I'll be just browsing you through the cereal, the different fermented foods, the cereal, this is the cereal and the pulse based fermented foods which we all relish at our own different cities, the doklas, the idlis, the dosas, the sourdough, and the fermented rices, the pic which I took in the morning in the hotel, which and I think if people have tasted the fermented rice, it was really tasty. Then we have the cereal based from the Rajasthan. So all over India, every city has their own cuisine, has their own fermented thing in their cuisine. So it's the kanji vada, if you must have tasted. Then we have the panta bhat from the Bengal area. We have the miso from the Japanese, which is made from soybean. We have the kimchi, the sauerkraut, and the different pickles, if you can say. These are made from the cabbage and which are fermented and have good health benefits. Then for the vegetable based, we have the kanji and the kombucha, which has been taken as a fermented foods. So what exactly the fermentation of the foods do? They increase the nutrient bioavailability, especially the proteins and the amino acids, and they reduce the anti-nutritional factors, the phytic acid and the tannins in the food, and they generate, there is a generation of the bioactive peptides via enzymatic hydrolysis. Again, fermentation, it improves the digestibility and it promotes synthesis and transformation of the nutrients. Of course, all these fermented foods, they are rich in antioxidants and they have anti-inflammatory properties. It is the short chain fatty acids, particularly the butyrate and the propionate, which exert beneficial metabolic effects in diabetes. And the fermented foods are thereby it improves the insulin sensitivity. It activates by the activation of the AMP kinase, the signaling pathways which we are aware. It also has anti-inflammatory effects. It reduces the pro-inflammatory cytokines, especially the TNF alpha. And it has enhanced gut barrier function. If the fermented foods actually also, it reduces the gut inflammation. It basically reduces the endotoxins, and it improves the gut barrier integrity. It reduces the oxidative stress, and thereby it suppresses the pro-inflammatory cytokines. And overall, all these fermented foods especially improves the insulin sensitivity, and it has a gut balance. Yogurt, especially, if you have seen that, usually that is the thing what we have been adding in our plate, and it has shown to reduce type 2 diabetes risk factors. Even it has shown to reduce the lipid profile. This is one of the study which has shown that it's of a 6-week study. Just having 300 grams of probiotic yogurt has shown to reduce the lipid levels. The LDL has been significantly reduced, total cholesterol, and which has shown it supports the cardiovascular risk reduction in type 2 diabetes, and it can be used as an adjuvant therapy. For weight loss, of course, yes, it regulates your appetite, it improves your blood sugars, it supports your fat metabolism and reduces inflammation, and finally it enhances gut health. Again, the fermented vegetables, with lack of time, I'm just browsing through vegetables. Fermented vegetables, again, it lowers your postprandial glucose excursions, reduces your glycemic variability, improves your insulin sensitivity, and also it has an anti-inflammatory and antioxidant effects. So the traditional foods, we all know that these traditional foods, whether it's your dahi, dhokla, dosa, they have been embedded in our traditional culture, and they are a rich source of probiotics, bioactive compounds, and micronutrients, and must be added on our plate. It can be added in your breakfast, in your lunch, or maybe in your dinner time. Again, it has to be balanced meals rather than a large quantity. Finally, yes, fermented foods do exert beneficial metabolic effects, and therefore it should be added. There is clinical evidence which has shown, there are RCTs, there are meta-analysis which has shown there are improvements in insulin resistance, glycemic parameters, and cardiometabolic risk factors, and fermented food should be integrated as an adjuvant to the standard diabetes care. So my final take-home message would be that yes, fermented foods influence metabolism by microbiota-mediated pathways. There are clinical benefits which we have seen, and they are modest but consistent and biologically plausible. They should be added to your plate. They offer a cost-effective. They are very, I think they're very pocket-friendly when we are talking about Ozempic and other things. I think that if you're going to add fermented foods, would be something, a healthy thing to your plate. However, long-term trials are needed. So finally, my one-liner message is that I think from now onwards we need to, we should not forget that to add a fermented food to your plate. And I think here in Chennai, we need not even tell whether the plate is already loaded with fermented foods like for your idlis and dosas. So thank you so much.